Welcome to Chronic Conversations, the podcast that brings a voice to the stories behind chronic symptoms. I'm your host, Katherine Rose, certified integrative health practitioner, founder of ThriveWell, and soon to be published author. After years of battling unexplained symptoms and finally getting a diagnosis of Hashimoto's, I turned my pain into purpose. Now I help women just like you feel seen, heard, and validated, while uncovering the root causes of symptoms and helping to create lasting wellness. Each week, I'll share insights from my own journey, some proven strategies that I use with clients, and conversations with fellow experts and warriors. You're not alone, and you can thrive. Now let's get into today's conversation. Welcome back to Chronic Conversations, y'all. I am so excited about today's guest. She really is the definition of strength and resilience and real world advocacy. Shemekka Marty is a lupus survivor, kidney transplant recipient, caregiver since childhood, and now a leading voice for chronic illness patients navigating a sometimes broken healthcare system. She's not just surviving, like a lot of us feel like we are sometimes. She's showing up in Washington. She's speaking on national stages and helping women like us feel seen, heard, and empowered. Whether you're exhausted from being dismissed, from your symptoms, overwhelmed by medical red tape, or just trying to stay afloat and get through the day, this episode is definitely for you. Let's get into it. So I really appreciate you taking the time.
Oh, no, I appreciate the invite.
It really is such a gift to have you speak to not only to me, but to everybody that's going to be hearing this. I think they're going to get so much out of it. I mean, I know they are in general, but so many of us with chronic illness go through this, the healthcare system, and have very similar experiences and just come out feeling defeated and dismissed and all those negative feelings. So I am so excited, and it's just such a gift. So I appreciate you being here.
Oh, yes. Let's talk about medical burnout. That's what it is. It becomes medical burnout.
Yes. First, though, will you tell us about yourself briefly, because I have some questions later.
Of course, my name is Shemekka Marty. I am originally from New Jersey, so my attitude is mostly because I'm from the East Coast. I moved to California about 10 years ago, and most of it is because of my background. My mother grew up with lupus, and my grandmother had severe rheumatoid arthritis. I started out as their caregiver, and when I was about 10 years old, and so I've seen both sides of it. Once I became diagnosed with lupus, and this was about now going on 16 years ago. And I discovered, and it's a thing that people don't realize, it's real world experience and environment. And my environment, and anybody right now that's in the East Coast knows that it's super cold. I became really bad whenever it was cold. And one of the illnesses that I had really affected my fingers. And my husband has a job that he can pretty much go anywhere. And he said, hey, I think we should leave. He used to be in California when he was in the military. And I said, okay, maybe I'll consider it, and let's just go out there. And then we just moved cross country, didn't know anyone. I didn't know anyone. He knew people, but not where we moved to, and created an entirely new life. I was just beginning to talk about lupus on a bigger scale. I would do things with the walk. I would help out people. Like I said, I was a part of the Autism Foundation. Everybody thought I had a child that had autism. No, I just like to help. And I have 20 years experience in cybersecurity. With that, I also helped out my uncle who had HIV. He passed away going on 2 years. And so the caregiver in me, my health journey, nothing was really where it was. I wanted my professional and my personal life to align. I mean, I'm doing all this stuff, making a lot of money, doing IT, but it doesn't really serve me. So I decided my love of sports and being able to talk to a lot of athletes, I found a gap where not only do, regular people, but athletes, people think that they have access to really good healthcare. They do when they're in the game. But when they are off the court, people forget about them unless they're a well-known name like Michael Jordan or LeBron James or Charles Barkley, and they keep the name going. And so all of my affiliations, the things that I've done, I am also the chairwoman of the Paramedic Advisory Board of Northern California. I'm a part of the Lupus Foundation of America, Lupus LA, the Lupus Foundation of California, anything that's lupus related, even though I have 15 different autoimmune conditions and I've had a kidney transplant and I've had a stroke. And, you know, like the list goes on. I had a full hysterectomy, you know. Besides all that, that's what started my business, Beyond the Game Health. And being able to go to underserved communities, because I do a lot of health productions around big name sports, meaning Super Bowl. That's why I'm incredibly busy. And doing events with alumni of the NFL, of the NBA, getting that awareness out there. We bridge the gap between health and sports. And that is by attacking people that are not really thinking about health. So everything that I do has a health initiative. And with that, if I'm doing something around Super Bowl is one of the highly watched sporting events besides soccer in the United States. Let's just say now soccer has throughout the world. I build an event around that. I'm attacking people from all places. And also whenever they do these events, they're in underserved communities. So we make sure that we bring the kids together. Like our initiative right now is sudden cardiac arrest. When you see kids collapse on the field, and it's due to an undetected heart issue because we do not have comprehensive medical screenings or in a physical. And that's where my activism comes in, where I can actually see and help people. I get my why from having legacy and knowing that when I saw my mother pass away, she was only 44 and I was 21. I want to make sure that people can at least take care of their health, because health is wealth. And a lot of people just neglect that. And no matter what, even if you don't have an autoimmune condition or a disease of such, maybe cancer, everybody goes through something mentally. So we always make sure that we talk about mental health as well, and educating our collegiate athletes and our youth about what they should look out for. And it's okay to not be okay. So I think that was a good segue of mostly everything I do, but I'm not going to put all the other stuff in there, but this is my why.
That's amazing and incredible. And I have this question later on, but I'm going to ask it now. How do you do everything that you do? And with all the things internally you have going on, you know, how do you care for you? How do you make sure you're on top of your health and nervous system and all that kind of stuff? How do you take care of yourself with all this stuff going on?
I take care of myself a little bit better when I'm not under the gun right now. So I'm 10 days out from my event. So I'm just going to be I'm always honest. I'm not going to say, oh, I do this. No, usually I schedule time out to have a massage. For me, having a massage, or if it's really good weather, even though it's okay weather right now, if I can go sit by the water, that's what I do. Just taking time out, even just to not do anything. I'll lay in a bed and I'll just stare at the ceiling because I have to collect my thoughts, or just walk outside and just take a moment to myself. I learned from a retreat that I went to, the lady that was teaching us Tai Chi, and she was saying, you know, when people go like this and push stuff out, and she was like, that's taking all the energy. She's like, scoop up all the negative energy. She's like, can you do it in your room? Doesn't take long, 5 seconds, just scoop it up and push it out. And just I do that in my room when nobody's looking at me like, what in the world is she doing? Like, what are you doing, Mom? And like, you look weird right now. Are you trying to do Kung Fu? No, just taking a moment out, because even when I just sit with my thoughts for a second, it'll help. But when I can actually carve out time, and I have to be very proactive, where I'll put it on my schedule, I'll book in the middle of the night during my insomnia times. And because we always have insomnia, and I'm like, let me be productive and do something for myself. So I'm going to schedule a massage for tomorrow and block off my calendar and nobody interrupt me. But we have to be very intentional about it.
100%. Yes. Okay, awesome. So in your personal journey, like health journey, what made you realize, like, I have to start advocating for myself? What things and experiences have you gone through to feel like, what's an example of when you felt dismissed on, you know, I'm sure there are many because there have been lots of things going on, but which ones kind of stand out in your mind?
It began, the first thing that stood in my mind is how much I saw my mother dismissed. And that was at a time when electronic health records weren't a thing. So I, being the person that she would have with her, even though back then it was, you know, you're seen, not heard. So all that time I would just sit there wanting to come out of my skin like, Mom, fight back. Tell them no. Tell them that this is what's happening to you because I see it. And she just was silent. And the
Yeah.
only time that she would actually voice her opinion was when she hated being in the hospital. That's when she'd be like, I'm getting out of here. I don't really care what they tell me. I'm getting out. But when she would go to the doctor's appointment, she'd be very, very silent. So I took that with me, that when I was going through things and I already knew what to say because I carried that binder with me. And I was like, okay, this is what I'm going to do. When I first moved from New Jersey to California, my records didn't transfer correctly.
Okay.
And when I told him I had a stroke, and the guy just looked at me like, but you're talking fine. And I'm thinking to myself, well, I guess you were very poorly educated because, there's different types of strokes. And he was like, are you sure? And I'm like, no, I'm just making this up right now. Like, I don't understand why you're talking to me like this when you clearly don't have my records and this happened. And it was new when electronic health, because it hasn't really been out that long, where it was transferring. And they even gave me medication that I was allergic to. I was allergic
Oh my goodness.
to beta blockers. So my blood pressure had went down. I was like, nope, I'm not doing this again. I'm not going to have these doctors talk to me. Even to the point that even when my dad comes to visit, when I used to be in the hospital a lot, he'd go up to them and apologize to them because I would rip them to shreds because I said, Dad, you weren't here when he was dismissing me and telling me that he couldn't take me down to get this test done. I said, you came here 2 days later. I've been fighting for them for 2 days to get it. I was like, I started off nice. And then older people don't understand. I was like, I'm nice and I'll be nice. But then you almost have to be really rude or know exactly what you're talking about. And I said, I'm never going to be in that position again. So I became a patient advocate and learning things and giving my view and inserting myself into the conversation to learn and say, you know what, I may not have a PhD, but I do have a PhD, a personal history of the disease. So you need to take me
I love that.
little bit more seriously because whatever's in your book is not what's going on in my body.
Yes, it's so true. A lot of doctors don't seem to be, there's a time and a place, like for sure, conventional medicine. Yes, we are our own experts on our body and what we're feeling. And I feel like what we feel, we know best. That's how I feel. But it can be so frustrating in those exact situations that you're explaining and feeling crappy on top of that, trying to advocate for yourself. It's just hard.
Mm-hmm. And it's hard when you're in pain and I'm like, okay, you do see my blood pressure is over 200 right now. And the more you're pissing me off, the higher it keeps going. And then when they ask me, are you in pain? No, it's just a magic trick that I do to make this thing go up.
They were affecting your blood pressure. So even in situations like you just described, or when women are in an appointment and they're told, it's just in your head, but you don't look sick. I saw a quote somewhere that you said, I may look fine on the outside, but I'm still sick. What tips would you give us to kind of steer the conversation back, kind of take ownership back of the conversation of like, no, what I'm feeling is real. And I need you to hear me. Like, I need to talk further through this.
I'd like to present to other people that because doctors are more...
Y'all, real quick, before we jump back into today's episode, I want to take a minute to talk to you, especially if anything you've heard so far has felt a little too familiar. If you've ever felt dismissed, misunderstood, or like you're navigating your health completely on your own, I created something for you. And it's called the Kaya Collective. Kaya stands for Come As You Are. Don't worry, it's not another program or place just to get more information. It's a space where you don't have to explain your symptoms, prove your pain, or push through to just keep up. Inside the Kaya Collective, you'll find real conversations, support from women who actually get it, and tools to help you actually understand what your body is trying to tell you, but without the overwhelm. It's for women who are doing all the right things, but still don't feel right. The woman who's tired of surface level answers and ready for something deeper, and the woman who just wants to feel seen, heard, and supported. Again, if that sounds like you, I would love to have you inside. You can learn more at the link in the show notes, and I'd love to see you there. All right, let's get back into today's episode.
Scientific. You have to play their game because it is a game. It's a game of getting them to listen. So you go to the grocery store, right? And you make a list for the most part, unless, you have it on your phone. Some way, shape, or form, you make a list because you want to check things off. Well, how often, if you just polled 10 people, how many of you make a list before you go to the doctor?
Yeah, they're not many.
And it'll be less than, the norm, what you would want and what you expect. So what do they do when they get your blood test results? They look at it, even though they're not listening to your symptoms because they can't see it, but they will look at what you wrote down.
Yeah.
And that's how you present to them and to make your doctor's appointments efficient. Now, I particularly don't, because I have it in my head where I'm just like, all right, I develop a rapport with all my doctors, and I don't expect everybody to do so. I already let them know, hey, I am a patient advocate. You can talk to me like you would talk to your colleagues. I'm just going to cut to the chase. And usually when they try to explain stuff to me, unless I don't know it, I'll be like, okay, I already know what that is. Let's cut to the chase. Did you look at my chart? Did you do this? But I would say to regular patients that just go in, be very effective. They try to cut it down to 15 minutes. Well, you make it easy for them. You're going to go by my test results and tell me that there's nothing wrong. Your labs look great. Okay, fine. Well, I'm going to tell you on Tuesday, this happened, blah, 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 blah. Come in there and show them. And I'm like, now, so explain to me why this happened then. Why did last Tuesday, did I have heart palpitations? I ate this, this, and this. Make a diary. Make a list.
Yeah.
Even sometimes have an accountability partner. When sometimes I go and if I forget something, my husband will be like, well, tell about when you tripped and fell and blah, 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 blah. And I'm like, oh yeah, forgot about that. I wanted to forget about it because I try to not think about all the things that are wrong, but you can't see it. However, you can see what I wrote down. And then that way that makes it more, because that's what they look at. They look at what it says in your labs. Do the same thing for them.
Right. Okay. Yeah. I was just picturing like a list of questions so you don't forget anything with brain fog and whatnot. But of course, symptoms and diet and
symptom trackers. And, I have my little, it's not coming through here, but I have my watch. Most of us have a watch, some type of wearable device that keeps things. Like we look and say, oh, I took 6,000 steps. Well, how many women have heard where the doctor said, well, maybe if you lose weight, well, maybe if you exercise. And then, you know what? Put it back in their face. Hey, doc, yes, I did. See this? Here's a little printout, because you can export it, but nobody thinks to do that. Take this stuff that we have now. We have all of this tech. There are symptom trackers that are online. Download an app.
There are.
Get something on there. We have to start utilizing all of this technology that's out there for the greater good, which is for us. If this is your business, because your business is your body and you can hire and fire at will, then you need to present it and run it the way that it should. You are hiring the doctor. Remember, what you pay for in your taxes or what have you is paying for their salary. So you are able to talk to them and tell them, but you have to play their game and talk to them in the way that they communicate. So give them the analytics, make a diary, symptom tracker, what have you. Not only just make a list of your symptoms so that, my husband has a long list that he has to go through with his doctor. And his doctor said, okay, we're going to go through, items 1 through 4 today. Now, when you make the other appointment, we'll go through the rest of them. But that makes it productive. You know that everything's going through. I'm a very task-oriented type of person.
Yeah.
And you can do that with your doctors too, because at least, I feel like I'm not getting anywhere. Well, help them help you, because it is not just help me and they're gods and you're going to have a magic pill. Unfortunately, one of those pills is going to probably give you something that you don't really want. There's nothing that's going to cancel out, but you got to do some work on your own.
You're right. Absolutely right. So multiple doctors, if somebody has a team of different specialists, in most cases, they're not communicating with each other, and the patient is the one saying, well, telling this doctor over here that this doctor over here said this and whatever. And that can wear you down, of course. And lack of communication can be really frustrating. I know you probably for yourself might have it down pat communicating with different doctors or specialists, but do you have any tips there? Would it be along the lines of what you kind of said of writing it down or emailing everybody in one?
I mean, that is a thing. I do have colleagues that are patient advocates. One that she had cancer. She's cancer-free right now, but for the most part, she has all of her doctors on a group chat. Okay. Now, that's like a scenario that is very rare. Okay. Yes. And I'm going to admit to that. For me, I called in my quarterback, which was my rheumatologist. When I was going through the worst part of my journey right before I had my kidney transplant, I remember I was away overseas. I think I was in Austria, and I told him, I was like, I can't walk anymore. My feet are so swollen. That's one of the things that happens when you don't have an active kidney. All the water just goes down. And I said, I can barely walk through TSA. He calls me immediately and he's like, I got a hold of your other doctor. And even though, I go to different specialists, they're not all on the same type of system. I already know that because I am on the interoperability board. Interoperability, in case other people don't know, is the ability to exchange patient information throughout other exchange systems. So even though they may have Epic and My Chart and My Health Do Not Talk, that's something that I'm on the board trying to work on. But
That's
anyway,
awesome.
When I told him, he was like, all right. He's golfing. He's in Costa Rica. I told him he needed to talk to me and he, rallied. He retired. I have to train my new rheumatologist and she's just as good, but not as good as him. But just having that relationship where as soon as I got out of the airport, when I was en route, called me. He was like, your room is already ready. I already told them what's wrong. So they knew exactly what to do. Wow. Again, that doesn't happen to everybody too, but I put in the work when I go to these doctors and I let them know I am an ally. I know it's stressful for you that you are given this task of trying to fix like 10 people a day. Okay. Maybe you see 10 people a day and that is stressful. And I recognize that. I check in with them. How are you doing? I know most of my doctors have kids. I ask, how was Joey's soccer game? And I get to know them. They're not a robot. They're people too. Yeah. And just letting them know that I understand sometimes really does help the communication and they'll do more for me. They're like, nope. We got to help Shemekka out. And I ask certain people like, oh yeah, well, I asked the doctor. I'm like, no, but do you really ask them? Like, I know some of their wives' names, their spouses' names. If I see them outside, I'm like, oh my God, it's so great to actually see you, not in an office. And I do run into them. But just being able to ask sometimes, hey, do you have a system where we can work together? Or at least can I sit in front with you? And I tell them, you're allowed to turn. Oh, like, can you turn that around? I want to see what you see. Because I know what I see on my phone, which is completely different than what you see. I want to know why every time I go in there, you guys ask me, am I pregnant? When you should know I had a hysterectomy done at this very hospital. So you guys don't communicate. Where's the tab? And I want to see it. And I'm like, okay, because I want to understand before, just so we can talk together so that we can bridge this gap. And just figure it's going to be a different scenario with everyone. But getting them on the same page and just asking, usually if you have an autoimmune condition, you'll have a rheumatologist or you may have a neurologist, whoever's your main person. Your physician, your primary care physician is loosely used. I wouldn't say they would be, but whoever is the one, if you have a neurologist and that is mostly what you're dealing with, whoever is the main one that you see, get them to get on board and say, look, I need you to talk to my gastro because not only is this happening, but this is happening. And we need to get on the same page. And I'm going to that one because he's a great doctor in this network and you're a great doctor in this network. But my gap is you guys don't talk. And I'm sick of every time going to my phone. Well, look, I had this done. I had, let me put it on my phone and can you call, and they can call each other. Can you talk to Dr. whoever and you guys talk it through and get back to me? You have to insert yourself because they're not going to do it. It's almost as if like, if you don't, a closed mouth don't get fed. Right. There's nothing wrong with asking. You're allowed to ask. Sure. And like, here's my information to talk to them. I want you to review my chart together and then let's come up with a solution. I need to do this. And a lot of doctors, even when I call, they'll call me back after and it'll be 5:30. And they'll do their notes. Some of them actually do. There are doctors that care. There are doctors that don't. If you don't have a doctor that doesn't care, get rid of them. And if you can, because I know that certain people have doctors because the type of coverage that they have to have that. Yeah. But just ask. There is a new system. It's called Open Notes AI, and it's supposed to be a communication between the patient and all of their doctors. It's being tested in New York, and because I get a chance to go to all these conferences, I get a chance to know all the things that are coming out before the general public does. It's just that I wish they would roll it out a lot quicker because it will help out a lot of people.
Oh, and so that kind of connects patients with their doctors and doctors with
and it's a group. Well, you just pull in whoever your providers are. And that way you can all talk together and be like, but here's a tip. Yeah. When you go to get blood work done, if you go to get any work done, a test, ultrasound, whatever, copy all of your doctors. How many times have you gone and be like, I had this test done, and they're like, well, I don't see it. Here's how you solve it. When you go to get your blood work done, people don't know. You can say, copy this person. So every time I get my blood work done, the girl at the front already knows, but I've already trained her to do that. So I started a couple of years ago saying, okay, copy my primary care doctor, my oncologist, my rheumatologist, my nephrologist, like everybody. So everyone gets my results at the same time. And that way, when something alarming comes up that they should be aware of, instead of waiting for oh, well, I got your results back and you should really involve such and such. How many times have you heard that? And then you got to wait and make an appointment. No, you start including people on these things and they will have it. And that's how you bypass the system.
Sure.
Because they shoot out whoever you ask to have copied. They will shoot out the results at the same time. And sometimes the ordering physician doesn't call me back as quickly. My rheumatologist will come. She's like, your thyroid's off. Make sure you talk to your primary care doctor about that. And I'm like, thank you, because you probably didn't read it yet. But this is how you avoid it.
Yeah. Yep. I love that. And it sounds so simple too. I'm like, I don't know why we don't think about it, but that.
Because they don't teach us. Nobody, you
right.
just have to navigate this healthcare system on your own. And everything that I've learned is because I've been exposed to it from so many different angles. And since I was younger, just observing. And I said, okay, if I'm going to talk about it, I'm going to be about it. And then getting on the board and being able to see, okay, now I'm the patient advocate on the board. Everybody else is all MDs and clinicians. And I chime in and say, I don't know why y'all think that this was a good idea to do this, but on the end user side, and I said, I represent the patients because I have 5 different specialists. So for someone like me, this doesn't work. For somebody that just has one doctor that they see, this works. But if you have multiple doctors, this doesn't work. And I just had to, all right, well, while you guys are figuring out how to fix it, I found this loophole. Copy everybody.
Yeah. And also when we're asking even for somebody to copy all of our doctors on or asking for anything regarding our health in an appointment, I feel like we can feel guilty or feeling like we're asking for too much, and we don't need to feel that way. It's our health, and not just physical health, mental health too, because it affects every part of your body.
Yes.
So are there some tools or resources that women with chronic illness, don't realize we have access to, especially when it comes to, say we want to request a specific test, whether it's a blood test or whatever, or different medications? Any tips on that or getting around it? Or
so glad you asked. There's this little thing that people never ever look up called patient rights. Patientrights.com. Let's start there, because once you know your patient rights, then that empowers you to say, okay, I am allowed to ask my doctor, as long as you're not asking for something that's like really outside of the realm. You don't ask for something that has nothing to do with you're a hypochondriac kind of deal. Yeah. But if you're saying, no, I really think that this is happening, can I please have this? And if they refuse, to one of two things. Number one, remember, you are the consumer. You can ask. If they deny, tell them to write it in your chart. Okay, I want you to write in your chart that you dismissed my ask to get an MRI based on what? And it could be the fact that they don't want to say that you have crappy insurance, but I want you to write it down that you refused, and I want it noted in my charts, in my patient summary, because a lot of people don't look at their patient summary, and I will sign it and you will sign it, and then they'll just back up. And they're like, okay, I would like to understand why. If you just tell me my insurance won't cover it, I'm cool with that. And then I'll fight the insurance. Then I'll go to the next step. But if you're refusing because you feel as though you're dismissing my claim, then I want you to put that on there, because they're very hesitant about what they put their name on. And so you remember that you are the ones that pay for their paycheck. They may say, oh, I don't work for you. Well, some way, shape, or form, my money, me being here, what I've worked for, pays for it. We don't have universal health care. That's not here in America.
Right.
So again, not to be cocky and be like, you work for me, but no, just know that you actually are entitled to have this type of care.
Yeah.
That's just one of the things where you have to empower, like those people that are older, or I would say ones that don't feel as though that they have a voice. They usually, okay, all right, I'll take this medication. I never take any medication without reviewing it myself, right? If you go to a restaurant, you have a recommendation and you're like, let me see how many stars. All right, what did they say? And I usually go through a very, very in-depth type of search. All right, maybe the first 5, as long as the first 5 reviews are good, I will go because they're fresh. Now, how many times do you do that when you get a drug? Most people are like, oh, you told me to take this drug. And I'm like, where's the research? Where's the research?
Mm-hmm.
Okay, research this drug. There is a site called This Worked for Me.
Mm.
And that is what it's called because people will put in there, you go under the drug and it'll say, I have lupus, I have MS, and I took whatever drug, and this is how it affected me. Now, we all have to understand something that you might take may not work for me. And I can always say for lupus, there are no two lupus patients that are alike.
Mm-hmm.
But at least you can gather the information and say, okay, most people have the same thing. It messes with your stomach. All right. Don't look at just what's on the side effects on the box because they went through FDA process and they probably went through like 10 people that don't look like you and in a different age bracket. All they need are the numbers to approve it and pass it through FDA. You go through this site or any other site because there's also good RX reviews. Do your research, people. Yeah. Again, I know it's the medical burnout, but to alleviate this, we have to be smart about what is going into our bodies. And right now we see too many people that are, okay, it's a game of whack-a-mole. I take this drug and then I take care of this, but then this pops up and then this pops up and you're constantly going like this. Well, let's start reviewing it and saying, Doc, I'm going to take this prescription. I'm going to heavily review it. I'll let you know if I take it.
Yeah.
And just go ahead and make sure that that's one of the tips that you can do to help you. So you're not like, oh my God, these headaches. They usually tell you, oh, you might get this, this, and this. All right. But what is the efficacy rate? How many people have taken this and the doctor's suggesting it? But what good is it going to do? How many times have you taken it and they're like, well, wait 30 days. Okay, well, those 30 days are killing me. And is there going to be an end? Is there going to be a light at the end of this tunnel?
Absolutely. And that site sounds so helpful and just a reminder for people not to just take whatever their doctor gives them. Do your research.
Yeah, I'm not saying never take anything. I'm just saying
I know.
I'm like, I want to preface that for people. Like, no, still take something. Don't refuse.
You made it clear. Mm-hmm. So you've taken your experience all the way like to the legislative level, which is amazing. Can you talk more about that and what specifically, like electronic forms or something about patient forms? I could be wrong. You tell me all about it.
One instance, I testified to the FDA that we need better drugs for CKD, which is chronic kidney disease. That's basically what you have before you go through a kidney transplant. So the drugs that are out for CKD are so outdated, they haven't really done anything since the 90s. And it's like, okay, what you have out there actually makes us sicker. And I had to testify and show them pictures, which I have no problem with. I'm one of those patients that, if you don't want to talk, I'll talk for you. I'll scream at the top of my lungs like, this is what's going on. It's perfectly fine. And I show them, pictures of me in the hospital, let them know at night I was itchy. These are the things that I'm experiencing. And then the drugs that you have are still doing this, this, and this. Yeah. And giving them unfortunately, I look the way that I did, but I say unfortunately because I'm like, oh, I'm sorry, I don't have a cane and I'm hobbled over for you to believe me. But here are some pictures of when I did look like this.
Yeah.
To testify to the FDA, the people that actually make sure that these drugs are in production. That's great. And that's where I'm like, I wish this could have happened when my mother was alive. Now, the other thing is when I'm going through and when I tell people what interoperability is, and I'm like, if you have multiple doctors, I'm helping you so much because the ability to have all of the information to each of your specialists when now they can have a chat GPT summarize everything. I'm hoping that the time that it takes to diagnose stuff when it takes 5 to 7 years, that it takes much less than that, maybe 1 to 2. And with AI technology, it shouldn't even take that. Yeah. But I know for my diagnosis, it spread a few years because it was like something happened here, then it went down. Then something happened here and it wasn't back to back. It was throughout several years and no one could understand how it was happening. I equated it to a serial arsonist where it was like, there was a fire on this street, put it out. And that arsonist hid for a little bit. Like, I don't want to be too obvious. All right, next year, I'm going to set a house on fire at the same street, but all the way at the end, and just putting it together where you're like, all right, well, it was just a random fire, right? Because it happened this year. Until it became on fire where it was just like, all right, we're going to set all 3 on fire. And okay, now we know it's this person that's doing it. Yeah. And that's how it became. I had one issue, then I had hives. I couldn't open my hands and this, and it was all right. But I already knew because it was going to probably happen, being that my grandmother had an autoimmune condition. My mom had one. My great aunt has MS. And I was like, okay, well, pretty sure, guys. But they didn't want to go that route. And I said, I had to research, all right, what can detect it? Regular blood work can't detect it.
Yep.
Okay, test me for this. So it was just me pointing them in that direction. But right now, these are the things that when I testify to them and say, we need to have a holistic view, why aren't we doing that now? And it can help solve so many things once we have the information to have it all right there. Then there's the fact of, you don't think about your patient records relating to your dental. Whenever we talk about health insurance, it's always health insurance, vision, and dental. It's connected to your body. Okay. Why do we say that? The head's not attached, people. We don't behead people and then put it over here and say, nope, we don't only deal with this. We're just going to put this over here.
Yes.
No. You have to remember that your dental health also equates to your heart health, your eyes, and put all that. When I talk about those things, when I say all of your records, I mean your whole entire body. Because sometimes you have to remember, a lot of people, if you actually analyze it, most people hate going to the dentist. They don't really do anything about it. But if you actually take care of your teeth, your heart health is directly correlated, because it's coming down.
Absolutely.
To your teeth. And then if we put those two together, it's not just the specialists of the pulmonologist, the nephrologist, the all of those, your dentist and your optometrist need to be a part of that too.
Yeah, totally. Wow.
So that's where my advocacy goes.
Yeah. It's just everything that you're doing is mind-blowing to me and amazing. And your passion for it is awesome. I personally, and I know everybody listening, appreciates every single thing that you're doing.
My pain is my power, because it is truly frustrating. Right now, I am 46 years old with braces on. Why? Because the medication that I keep taking keep pushing my teeth out. Everybody's like, you have your braces on again? And I'm like, you don't understand what I have to go through in order to keep this kidney. I have to take this medication, which does this to my teeth.
Yeah.
And they don't get it. And I'm like, yes, the reason why I'm out there advocating, talking about health all the time, is because it is nonstop, 365, 24/7. Not only my life, and I know that somebody else is going through the same thing. And if they don't want to, because there's a lot of people that don't, I am perfectly fine with advocating for us all. But I also keep myself involved enough in doing podcasts like this, talking to you, talking to other people, to hear their stories and bring that to the front lines, to the table, and be like, no, I know other people who are experiencing this. I know I'm not the only one. I'm not going to base it off of that, but I can make my frustration, my pain, my power to talk to them.
100%. And yes, no, you're not the only one. And everybody listening, you're not the only one. You're not alone. That's one of my missions, as well as just to help women with chronic illness feel seen, heard, supported, validated. It's really important. And especially when you feel alone, it can really dampen your mental health and fuel depression, anxiety, and it can be a beast.
It is definitely a beast. Not only just with chronically ill, the biggest dismissal that I actually had was when I was having my third child. And I was really adamant about having natural births. So my first two, so I have three, my first two were natural. The third one wasn't, because the cord was wrapped around his neck.
Okay.
And it was me sitting at work, and I'm like, the baby's not kicking. And I call my husband and he's like, well, call the doctor. And I'm poking it, and I already knew what they were going to tell me, drink something with sugar. And I'm like, I'm drinking soda and nothing's happening. Like, he usually starts kicking my boobs and nothing's happening. And we go to the hospital and they scan me and they're like, okay, we got to go. He's losing oxygen. All right. Well, I know it was a dire situation, but they dismissed the fact that when they gave me the epidural, they're like, okay, you're good, right? And I'm like, no, okay. And they proceed to cutting, and I literally felt air on my guts. And I'm like screaming at the top of my lungs. And my husband's like, what are you doing? And they look at him like, does she normally scream like this? And he's like, no, she's in pain. Immediately kick him out, gas mask me and then just go. And I'm like trying to tell them I needed a second. And then when they cut me so high, I had to get cosmetic surgery down there to like move my stomach back down, because I understand I have a healthy son that's here around the corner who is 18 years old. But I've heard so many stories of maternal health where they dismiss women on so many levels. And we've seen it recently where there's women that have come in and some of them are like talking through triage. Why are we talking through triage? The woman is clearly in labor. You're supposed to take her up. And even Serena, you can't even say it's just women. It was Serena Williams who was dismissed. And she has tons of money and very well known. So if that's happening on her level, then there is something systematically wrong.
Absolutely. That is a wild story. And I'm sorry that you experienced that.
It happened, but I have my son. That's all I have to say is, okay,
you do.
I have my son. Okay, I didn't want it where, it was a very bad story. But yeah, I tell him all the time, like, you did this to my body. No, it's fine.
Well, I'm thankful
every mother says that.
Right? I'm thankful you have him too. Just switching gears real quick. Tell me and us about Beyond the Game Health. I want to hear all about it.
Beyond the Game Health. So I would like to say that it is pretty cool that we get a chance to work with a lot of athletes. And the fact that I live in the Bay Area, I have a lot of Bay Area NFL that are coming on board to help out the Super Bowl. So This is a really great time, and for me to be positioned here to do Super Bowl 60. And it started out as something that I was doing with NBA, because for me, NBA is number one, NFL, and then MLB. That's the way that I love sports. And it went from just doing NBA events, because I did NBA All-Star, WNBA brunch, NCAA, to now doing every single aspect of sports. I have a contract with the NFL, NHL, MLB. I'm working on FIFA, and we're going to soon enter into F1 in a few months. On top of that, we are going to open up Pro Legends health centers, and health centers that are specifically for retired athletes as well as collegiate athletes to get comprehensive medical screenings. And so with that, it has become something that it was way more than I thought it could be. We're also doing event productions and partnering with other entities that have foundations to help build their awareness. And when it comes to that, for instance, we have a partnership with the NFL Wives. So the NFL Wives are directly connected with the NFL. It'd be both current and former NFL players, and making them realize the health aspect. So I will ask them something that it's like, I can get you a partnership, meaning a sponsorship, if you tell me a health component, because I still have a lot of connections within the healthcare industry. And being able to, not only with my events, but broaden it where I can expand even further to these other foundations and have them talk about things that they didn't even think is something that would help them. And I asked them recently, like, does anybody have sickle cell or any direct connection to it? And all these women start talking about it. And I'm like, okay, I have a drug company that wants to do a campaign, and it would be great for you to partner with it. Yeah. And why would they throw money in it? Is because we're using the power of sports. And I don't care how. I want that talked about, because I can very well, when they said sickle cell, nobody talks about sickle cell. Right. I can tell you that in the autoimmune space, nobody talks about sickle cell. I hear more about POTS more than I do about sickle cell. Sure. And to be able to rally and bring that awareness out, and I'm a part of that, that's what my company is about, getting it out there. It's not about just making sure, we turn a profit or anything. And to me, not all money is good money. And if it isn't about health, I don't want to be a part of it. So everything that I do to rally about it, and I'll ask these other partnerships, okay, so let's tap into the health aspect, because that's what you're missing. We need to make an impact. Even if it's nothing that you guys want to talk about, we can always talk about mental health. Okay, we can talk about, the other things that are happening. Let's talk about women's health. We did breast cancer awareness last year when I orchestrated the WNBA brunch when it was in Indianapolis. And nobody knew about the 5 WNBA players that passed away from breast cancer. And it was great to honor them and talk about it and have mammograms on site, talk about what you need to do to go ahead when you're in the shower. How do you find it?
Yeah.
That's the impact that I like, and that's what we do. And then also having these webinars that we're going to be instituting starting next month, where you can have access to information that is not just on an event basis. We can talk about it on a webinar. Anybody want to talk about being a type 1 diabetic and being a basketball player? I had one of the basketball players that were part of my event last year. He was talking about it and how unfortunate for each league it's different. So once you're done, you are vested with healthcare dependent on different rules. For the NFL, no matter what, you don't have to play. You don't have to play 5 minutes. As soon as you get a contract with the NFL, you are automatically covered for 5 years. With the NBA, you have to play a certain amount of time. With the NHL, you have to play a certain amount of time. And I had a player that missed it by a couple months, and he doesn't have regular health care. But players aren't thinking about that. They're just thinking about, oh, I just made a contract. That's $10 million. Well, that $10 million is going to go by really, really quick if you get sick.
That's right.
And it wasn't until last year when I was going to ask Nate Robinson. He is a basketball player. He was a very well-known basketball player. He had to do a GoFundMe for a kidney transplant. I happen to know how much that cost because I got the bill. I didn't have to pay for that bill, thank God, because I had insurance, but it was $1.5 million just to get a kidney. Okay, that's a lot of money. Do you think he had that? He hasn't played in the game for about 10 years. And that's where we make the impact on a different level too. We're helping out these athletes that people thought of as gods. Not to say that they weren't, but you got to remember, they've been practicing since they were 3, 4, 5, whatever, that's why they retire at 35. But what does that look like? And that's what Beyond the Game Health is doing on a daily basis, talking to these athletes, giving them a platform to speak on, being able to talk about the things that they want to talk about, getting them back into the game. You don't know how many players have said, thank you, I want to still show the kids that I got it. And being able to put smiles on their faces and on the kids' faces because they're just so happy that, oh my God, this guy is like 7 foot tall and he's, playing with us, and we'll do a clinic. And that's what I can't wait for my event to happen in 10 days. It's a flag football event where I get a chance to see not only our players just get happy, because that's literally what he said to me. He's like, you think I can throw the ball around, show them I still got it? And I'm like, whatever you want to do. That makes you happy. That's what we're going to do. But taking over in every single aspect, even golf. I just came back, so I told you I was away organizing a golf classic. I really don't do anything with golf, but I'm going to make sure that we can get a part of it because all of these players play golf. And so why not tap into that market? What can we do to bring out more awareness and health aspect when it comes to golf? I'm pretty sure when you start looking up a specific disease and you'll just say, what celebrity? There's always one person that does have it. And you have to tap into them and like, can you please be the voice of it? We always see these ads for drug companies, but we want real people talking about real issues. I don't want you to endorse a drug. I want you to talk about it. And if maybe more people talk about it, then it will become more common. There are too many people that are ashamed to talk about it. And then kids who are affected with it, you have to start the conversation. And I don't want them to have to go through shielding it. I know what that feels like to try and shield something that, I don't want to be made fun of. And in this day and age, it being made fun of, as soon as something happens, because we're in a digital world, it spreads like fire. It isn't back in the day where you had to pass notes around and do all this other stuff.
Right.
So,
yeah, you're right. If you dig hard enough, you'll find a celebrity or somebody with something. And I hope that you'll find somebody in the golf arena that will talk. And I'm thankful when they do, no matter what they have, whether it's Hashimoto's or lupus. What's one piece of encouragement you would give to women listening right now that are just exhausted from feeling and being dismissed and gaslit and things of that nature?
I know it's going to sound really hard to do at some point, but I can say what has helped me, or when I tell people this, when they think about it, you always have to change your way of thinking. As soon as I was diagnosed, I sat in the car and I remember what my mom said all the time. She's like, are you done? So what are you going to do about it? And that's exactly what popped in my head. And I said, okay, it's not why me, because that's the first thing that usually happens is like, oh my God, why did this happen to me? Yeah. And I said, it's not why me, it's try me. You have to take your power back. And literally, if you Google anything that I have on YouTube, I lie to you not, you will see the video that I made. I think it was a day after I was diagnosed, and that's literally what I said. And the way that I look then versus the way I did now, and I tell people I'm thankful that I actually have this disease, because I don't think I was really, even though I went through what I went through with my mom and my grandmother, I was just coasting. And I was more intentional and adamant about being healthy to eradicate what was in me. So it was like, okay, man, I can see myself like, God, I can't believe I look that way. Now I look forward to when people are like, why are you doing that? I went to Alaska recently and they're like, why'd you go? It's like crazy cold. Yes, it was negative 25, but it was a once in a lifetime thing. I don't want to shoulda, coulda, woulda. You get one life. Are you really thinking in your bed like, I'm not going to do that? Oh my God. Oh, I'll do it my next lifetime. Are you going to remember this lifetime? No, but I'm going to remember this. I did it. And it's not why me, try me. I will figure it out. Stop thinking about the things you can't do. And what is that from Pirates of the Caribbean? Are you Mexican or are you Mexican? Totally true. Okay. You're like Captain Jack Sparrow when he said that. That is true words here. If I can't walk, because that happens a lot, where I can walk, but I can't walk long distances. When we go on vacations, I don't focus on the fact that I can't do that hike. I find a way to do that hike. So we usually will do that hike on an ATV. So I'm like, okay, that's cool. I can't do that walk, but I'll get there because I want to go see the river. I'm going to eventually do something. I focus on the things that I can do and get creative. And my kids know that. I'll be like, why do we do stuff on the ATV? Because mommy gets a chance to see a lot of area without having to walk. Yeah. Or when people are like, oh, you go out in the sun a lot, I can't do that. And I was like, you think I'm just sitting out there? No, I have a cabana. I will pay for that. I will put on my hat. And you know what? I'm not trying to sunbathe. I will continue to keep putting on my SPF and do all the things. But when you see those pictures, I try to explain to people, you will see me getting my blood work done, but you also see me having fun. And I'm not focusing on, if you keep continuing to focus on what you can't do, that's a downer. Then I guess you don't want to do anything. Why don't you try figuring out how you can get this done? Because when we have no money, we're thinking, crap, how do I get money? Okay, when you don't have it, and you're like, no, I can't go out. Well, what can you do? I can go on a picnic because that's free. I can go to a park because that's free. Start thinking about your illness, and at least you know what you're up against. You could be carefree thinking, I don't have lupus, I don't have cancer, I don't have this. But then you go into a supermarket. We live in these days, and somebody could shoot it up. I know what I'm facing. I already know what I'm against. I already know what I'm battling. And that can happen too if somebody just shoots up a supermarket. But at least I'm more conscious of what I can and cannot do. And I haven't eliminated everything. Look, there's plenty of people out there that have no arms that are doing makeup on tutorials. And I'm like, I can't even do it myself with two hands. Okay. So, right? Like, think about that.
Yeah, I love that. Don't think about the things you can't do. Think about the things you can do. And that'll help your mindset so much. Not why me, but try me. I love it. I love it.
I mean, even if you're like a paraplegic and you can't do anything, you can be a motivational speaker. You can tell people like, look, I mean, I can just say, pull the plug, but I know that I have a purpose. I do know I have a purpose, and that's to help other people and live by example. And at least when you see my content feed, it is completely authentic. If I'm having a bad time, I've been on so many vacations where I've had to have a nurse called to the room. And I tell people like, look, those were pretty pictures yesterday. Today is not the pretty picture. It was me on the floor because something randomly, it always happens, upsets my stomach.
Well, authenticity is always appreciated and loved on my end when you are, and when anybody is, not just you. Where can listeners find you, follow you, help support Beyond the Game Health? Tell us all that, and it will all be in the show notes as well, links and all the things.
So you can follow all of the wonderful activities on beyondthegamehealth.com, or my personal, whenever I'm speaking, that is on shemekkamarty.com. But I'm most active on Instagram, which is at Pretty Sick Lupus Chick, or at Beyond the Game Health. And we also have our TikTok is the same handles. I try to keep it very consistent. So at Pretty Sick Lupus Chick. I honestly just want to drop off the lupus and say Pretty Sick Chick, but it's been branded that way. That's what's behind me on here. And on LinkedIn, it's my name, Shemekka Marty. You will see that it's spelled two different ways. They're both right. It's a short, long story. I won't get into it, but they're both right. But yes, please, please, please like and follow either page. But anything about Beyond the Game Health, we usually keep up to date on Instagram, and you'll see a lot of content after Super Bowl because we're doing 3 events during Super Bowl. So look out for us. A little girl from New Jersey doing her thing about health that is going to be a part of the Super Bowl, a dream come true.
Amazing. exciting. Can you talk about real quick the 3 events, or is that like a surprise?
I'll just tell about the
little
one.
bit.
The other 2 are surprises. So our inaugural flag football event, because flag football is on the rise, especially for women. So we're doing it for boys and girls ages 10 through 17. And we're going to have 2 football players. One is Jeff Garcia, who used to be a former 49er and Philadelphia Eagles. Go Eagles. He's going to be there, part of our clinic. So it's going to be a classic camp. Right now, we already have 150 kids. We're capping it at 250. And we're going to raffle off some pretty amazing things. One is this infrared sauna that it's huge. It's like a cocoon where you just lay in it. So we have a lot of things that are geared towards athlete recovery. So we have that. And then we have products from Hyper Ice. So Hyper Ice is usually like the massage machine gun and the compression that you can put on your legs. So anything like to train like an athlete, these are items that we're going to be auctioning off. We have some jerseys to give away. We have some baskets for girls to give away. We have a person that's doing custom embroidery. She's going to do any type of, if you have your own logo design, she could do it on site. There's going to be food trucks. I'm the president of the Northern California Paramedic Advisory Board. So some of the students are coming out. They're going to do CPR training, a demonstration, and also, what else am I thinking? Oh, we'll have Stanford University clinicians there to talk about board psychiatry. So it's going to be a fun, engaging healthcare and camp.
That's awesome. I want to hear all about it. I can't wait to see your posts and
yes,
that you put up about that. Are there any other things you want listeners to know or anything else?
If there's ever anything that you guys want the government to hear, not like they just suck, where I want to hear your stories. I want to know. I always want to stay in the know. Please feel free to DM me. If you have questions, comments, concerns, how you should approach things, anybody can tell you. You can message me. I will message back. No matter what, I always feel that patients should be heard. And I want to be able to be that vehicle to get it to the right place. So anytime, utilize my social media. You can go ahead and go on my website and you can submit any type of inquiry. Or if you have an idea for an event where there should be more awareness. I've had people say, why don't they have these health conferences or things like this in this state? They're shutting down hospitals in this state. I want to know that, because that is health equity. And that's one of the things I'm about. Why are you going to keep shutting down all these hospitals and making people drive 2 to 3 hours just to get care?
Yeah. Oh my goodness. Yes. Shemekka, you are an absolute gem and a gift to the chronic illness community, the people fighting for their health in the healthcare space. I appreciate everything you have done, everything you're going to do. You've already done big things. I think you're going to continue to do big things and even bigger and bigger and bigger things. So I appreciate your time on here so much.
Thank you so much. I'm so glad I didn't have extreme brain fog, because no lie, I could feel it right here. And I'm just like, please let everything I say come out all right. Like, I am standing there, right? I'm just as normal as everyone else. I am right there with you. I struggle with it all the time.
Oh, the brain fog is reasonable. I'm detoxing from mold right now, so it's always something. Well, good luck with your events, and yes, we'll be looking to stay posted on everything you're doing.
Yes, follow me on Instagram. It'll be all I post.
Yay!
All right.
Thank you.
Thank you. Bye.
Thank you so much for joining me on this episode of Chronic Conversations. I hope you're walking away with a little more clarity, hope, and inspiration for your healing journey. If you enjoyed today's episode, I'd love for you to like, subscribe, and share it with someone who needs it. Every share helps this show reach more women who deserve to feel seen, heard, and validated. And if we're not connected yet, come say hi on Instagram. I'm at Call Me Katherine Rose. Plus, you can check out free tools and resources for your wellness journey anytime at callmekatherinerose.com. And until next time, take care. And here's to thriving well, no matter where you are on your journey.